Hello. Today we'll be conducting a history-taking assessment through patient interview. To start with, I'm going to perform hand hygiene first. Hi, my name is Christine, your student nurse for today. If you can please verify your first name, last name, and your date of birth.
Yes, I'm Danica July 13, 2002.
Okay. Thank you, Miss Danica. That was just to ensure that I am speaking with the right patient. We are here today to have a thorough interview that will help in assessing your overall health. Any significant findings from this assessment will be cascaded to the doctor for the treatment plan. So, Miss Danica, what brings you to the doctor today?
So, I had an accident and obtained wound in my feet, and it wouldn't seem to heal.
Okay. Aside from your wound in the feet, do you have any concerns?
Not so far.
Okay, thank you. Alright, Miss Danica, we will be looking at your wounds in a while, but before we do so, I would like to ask you some questions first. So let us start with demographic data. So, can I ask, Miss, how old are you?
I'm 19.
Your address?
Poblacion.
Civil status?
Single.
Your citizenship and religion?
I'm a Filipino and Catholic.
So tell me more about the wound in your feet, ma'am. When did it start and how long did you have the wound?
Days ago, I had this last Sunday, I guess.
Any idea how you got the wound?
While I was cooking, I accidentally dropped the glass bowl, and some of the broken glass hit my feet.
How did it look like when it started compared to how it is now?
First, it kinda looked like a cut, and it get worse.
Did you have the same wound in the past?
No.
So I'm going to take a look at your wounds to assess the appearance. So the size of your wound, it has a 1.5 inches deeper, and it has a color of a dark reddish, and the characteristics is a pungent odor, and it has a presence of pus. Any medications taken for your wound?
No.
Do you have any home or DIY remedies?
Yes.
Such as what, ma'am?
Herbal tea.
How is the wound affecting you in your daily life activities such as bathing, dressing, or eating?
I sometimes struggle with bathing.
Okay, thank you. Alright, Miss Danica. I have gathered all the necessary information I need for your wounds. So now I will be asking you questions related to your daily activities or daily function. Are you able to perform personal care such as getting dressed and feeding yourself without any difficulty?
Yes.
Do you have any concerns with regards to your elimination pattern?
No.
In urinating, ma'am? How about in defecating? Okay. Do you own a mobile phone?
Yes.
Are you able to navigate your smartphone smoothly?
Yes.
Who does the grocery shopping?
Me.
Are you the one who decided the foods to buy?
Yes.
Okay. Can you tell me who does the housekeeping at home?
Me.
What are your share of chores?
Sometimes I do my dishes.
Are you able to complete those tasks assigned to you?
Yes.
Do you drive, ma'am? Do you own a car? How often do you use the public transportation?
Sometimes when I do my errands.
Do you have any concerns with regards to handling your finances? Thank you for that, Miss Danica. Now let's explore your past health history. In general, how would you rate your health?
I could say it's 7 out of 10.
Okay. How did you give that rating?
I seldom got sick, I eat and sleep on time. I also do my exercise, so I could say that I'm 7 out of 10 when it comes to my health.
Okay, thank you. What medical conditions have you been told you have?
I was asthmatic back then.
Okay, thank you. How about diabetes, ma'am? have been tested or diagnosed of having high blood sugar? Did you have any history or problems with your heart, ma'am? And respiration?
No.
How about your mental health?
I sometimes get anxious and a little low.
Have you been diagnosed of any medical conditions? Do you have any allergies to food, medication, or environmental allergies, ma'am?
Yes.
What are you allergic of?
Food allergy like shrimp, crab.
Okay, thank you. What are your allergic reactions?
Rashes and difficulty of breathing.
How do you treat your allergic reaction, ma'am?
By taking cetirizine.
Okay, thank you. Were you admitted or hospitalized before any medical reason?
No.
Okay. What were the immunization given to you as a child?
As far as I remember, it's a polio vaccine.
Okay, thank you. Did you currently have a tetanus shot?
No.
How about Hep B shot
No.
or flu vaccines?
No.
At what age did you have your first menstruation?
13.
Do you have any problems with your menstruation cycle?
No.
Is your menstruation regular or irregular?
It's normal.
Is the flow heavy or light?
Like
How many days does it last, ma'am?
5 to 7 days.
How many pads can you consume in a day, ma'am?
Like 5 pads.
At what age did you first had your sexual intercourse?
I haven't engaged myself in any sexual intercourse.
Okay. So you're not currently sexually active, ma'am?
No.
How many partners do you have?
One.
Okay. So, mom, you don't have any history of pregnancy and abortion? Thank you. Over the past 2 weeks, ma'am, have you had your blood pressure checked?
Yes.
What is your usual reading?
130/80.
Do you experience any symptoms when your BP reading falls below or it's above normal?
No.
Okay. Over the past 2 weeks, ma'am, have you had your vision checked?
No.
Did you recently have a pap smear?
No.
Okay. Alright, I will now be asking related to your family history, Ms. Danica. Anyone in your family who had been diagnosed of any medical conditions?
Yes.
Can I ask who is it?
My mother.
Okay. When was she diagnosed?
Ever since she was a child.
Can I ask who are your parents?
Delia
And
Dito
okay. How old are they?
49.
So both of them are 49. How would you rate their health from a scale of 1 to 10, 1 being not healthy and 10 is very healthy?
I could say that my mother is 6 out of 10 and my father is 7 out of 10 because of their age.
Okay, thank you. Let's discuss about your personal health. So, mom, how far did you go in your school?
I currently secondary college.
Okay. What language do you speak po?
English and Tagalog.
Okay. Who do you live with, mom?
With my parents.
Okay. What type of home do you have?
Apartment.
What do you do for a living?
I'm still studying.
Okay. Do you have any other jobs?
Yes, none at the moment.
Okay. Any financial concerns are you currently facing at home?
No.
Okay. So, mom, do you have any vices such as smoking,
No.
alcoholic beverage,
No.
and prohibited drugs?
No.
Okay, thank you. So, mom, can you tell me about your diet? What type of food do you usually have?
Protein foods.
Okay. Do you take fast food consumption?
Sometimes.
How about soft drinks, ma'am?
Sometimes.
Junk foods? Okay, thank you. What are your hobbies, ma'am?
My hobbies are watching movies and series and also exercising.
Okay. How often do you take your exercise, ma'am?
Like 2 times a week.
Okay. What kind of exercise, ma'am?
Like outdoor exercise like cycling.
So, ma'am, are you currently in a relationship po?
Yes.
Do you feel safe?
Yes.
Has anyone hurt you physically?
No.
Abused you verbally?
Yes.
Insulted you po?
Yes.
Threatened you?
No.
Okay. Do you have someone who can help you when you're emotionally upset or during tough times?
There's a lot.
Who would that be?
My friends, my partner, and also
How often do you see or talk to each other po with your partners?
every time.
Do you keep the doors locked up?
Yes.
Do you wear seatbelt po when you're riding bus or car?
Yes.
Do you apply sunscreen?
Yes.
Do you have a living will po?
No.
I have asked all the questions I have, Miss Danica. I will cascade this to your doctor. Do you have any questions?
Not so far.
Okay. Then thank you for your time, Miss Danica. That ends our interview for today. Let me walk you to the door. So for the general observation, Miss Danica Galmayo, my patient, 19 years old, single, living with her parents in an apartment and residing at Poblacion Merdeo, Cebu. Patient appears to be orientated and dressed casually for occasions, seasons, and appropriate for her age and gender. With noticeable characteristic noted, infinity tattoo on her left wrist, one piercing each earlobe, and make eye good contact, and was able to converse well. My client exhibited no abnormal movements, and that wraps up my return demonstration about patient interview.